up at home virtually for Melissa Neitzel. Hey, hey.
Hi.
Since our core audience is compiled of teens, and that's usually between 13 and 18, I like to ask all of our guests this first question, and you just paint a general image of your teenage years to now.
Definitely in high school, I took part in band where I played flute. And then also choir. Yeah, I noticed we're both
okay, shout out to the flautists. Did you always know that you wanted to work in this particular field, or is this something that just kind of came later upon your discovery?
I didn't know about music therapy right after high school. For me, like, performance gives me a lot of anxiety, and so being in front of a crowd is not really my thing. So I actually started to pursue composition and went down to Columbia College for that. I actually had a friend tell me about music therapy when I was I think it was like 25. Okay. So I finally found out about it. And that's how I got into the program and decided this is a perfect fit. Like, once I read the website, I'm like, oh yeah, this is what I need to do. It's using music, I'm helping people, like, this is where I need to be.
Generally speaking, what is music therapy?
Thinking about it in a really broad sense, working with specific goals that we have with our client, right? And we're using music to help achieve those goals. In the hospital setting, I'm working with patients to help with their pain, any anxiety that they might be having during procedures. I'm finding ways that meet the patients where they are and their skill level, and making an intervention to help address that. So I'm helping decrease their pain perception and their stress levels. It's
important to know for everybody at home, like, there's no one particular way to get involved in this. And I think it's really cool that you can tailor it to depending on what the needs are of your patient. Now, is there any particular skill set required for like somebody to come into music therapy? Like, if I know that I like this instrument, but I have no idea how to keep a drum pattern other than a neo soul beat like me, like, is there any particular skill set ever required for any of these things?
No. So music therapists should be able to structure their interventions to meet you at your skill level. So we're not going to ever expect anyone coming to music therapy to be musicians and winning Grammys and all of that.
Right. Cool. Yeah. That's a really good question. I wanted to point out for anybody that's thinking, like, no, you don't have to have 2 years of band under your belt in order to really appreciate the value of a music therapy practice. So definitely keep that in mind as well, guys.
Slowly open your mouth and move your jaw gently from side to side. Now let your mouth close, keeping your teeth slightly apart. As you do, take a deep breath in and slowly breathe out. While you tighten one part of your body, try to leave